A molar pregnancy is a rare but serious complication that impacts around 1 in 1,000 pregnancies in the US. In this video, I talk with wife, mom, and nurse practitioner Julia Dancyger about her own personal journey of healing after molar pregnancy loss.
I not only had to grieve the miscarriage, the fear of my health, but now it was more like the fear of losing my life.
So, as a nurse practitioner and as someone who has gone through it, how would you explain what this pregnancy complication is to someone that's never heard of it before?
Essentially, a molar pregnancy can be either a partial molar pregnancy or a complete one. So with a partial mole, there's a chromosomal abnormality where 2 sperm fertilize 1 egg. And then there's a whole another set of chromosomes for that reason. Normally we have 46. And then so we'd have a whole nother set. 46 plus 23 is 69. But it doesn't have a whole additional 23 chromosomes. So then there is a complete molar pregnancy where there's no fetus, just a placental sac. Additionally, is that it's considered pre-malignant. Essentially, the placenta, once it's removed, after it's found out, it can regrow. And so that's why providers are extra cautious about it.
And this was your second pregnancy, correct?
Mm-hmm.
So did you know what a molar pregnancy was before it happened to you?
No, I hadn't learned about it. I didn't know about it. I studied primary care and geriatrics, and there wasn't like a women's health OB-GYN rotation, or rather, I chose not to have that rotation. Ironically enough, I had something happen to me, and then I started working in women's health.
So what were your initial thoughts upon learning the diagnosis? Or I guess maybe let's just start up to the beginning, wherever the beginning is that you choose to share with us.
Yeah, so we had tried to our first child was conceived on the first try.
Wow.
The second one, which is the molar pregnancy, was a few tries. And then I had been pregnant for 9 weeks. And I went to the gynecologist. She did an ultrasound. She said it was fine. She said that there was some enlargements in certain areas. And then I did a genetic screening with Natera.
Mhm.
And they said that there could be an abnormality called triploidy. So triploidy is when that extra set of chromosomes happens, like the tri. She said, or I could be having twins, but she didn't see any twins on the ultrasound. And then in order to definitively diagnose it, she said, we need to do a blood sample of the umbilical cord. So that's called a chorionic villus sampling, and it's invasive.
At
So
9 weeks? You did that at 9 weeks?
that can only be done at 12 weeks. And so I returned to the clinic. I went then to a different provider at 12 weeks because there was some lag between getting the results and this and that. So essentially, from 9 weeks to 12 weeks after I received notice that it could be triploidy, I waited. And I got ultrasound again at 12 weeks. And I was also preparing to get the chorionic villus sampling. And he said, there's no heartbeat anymore. So they didn't need to do the sampling. He said that it looked like it stopped growing right after my last ultrasound. So the doctor told me the news. I started to cry. He said I needed to remove it immediately because it posed a risk to my health. He told me that it was a molar pregnancy then. There was hypervascularity, so the blood vessels in the area were really thick, bulging. He said that there was a lot of cysts on my ovaries from the increased hormone production. And then, essentially it's kind of like the placenta just went rogue. It just grew and grew.
Increased hormone production of HCG, right? It would give abnormally high levels of that particular hormone, or is it for
Exactly.
more hormones?
Mm-hmm. Yeah, of the HCG. So that's how it's trended. during a molar pregnancy and afterwards. The HCG has like a certain kind of doubling time where it should double in 48 hours, but with a molar pregnancy, it'll be even more than that. By the time I had my DNC at 12 weeks, so after I saw that last doctor, he said immediately go remove it. So a few days later, I got the operation. My HCG was 450,000. And so for 12 weeks, if I remember correctly, it's supposed to be from 30 to 200,000. So mine was a lot higher. So, pregnancy naturally comes with a lot of symptoms that are somewhat normalized. But, I was nauseous in my first pregnancy, and this was something different. Uh, I had accompanying symptoms and like this sense of like immobility and being kind of paralyzed. I had palpitations. I had depression. I had reoccurring yeast infections. I had such extreme fatigue. I mean, there wasn't a minute in the day that I felt that I had energy. And then I would be cleaning the house and I had shortness of breath and I had to sit down. There was just a lot of blood flow rushing into my uterus. And I had looked like I was about 6 months pregnant when I was maybe 3 months pregnant. So,
So the DNC was the main procedure, just to remove everything?
yeah. So the DNC was the main procedure to remove everything the first time. After that, they said to get HCG levels drawn every week. So I'd return to the lab every week from October to January. And they're supposed to see a 10% decline in the number every week. So the first week, it was like 250, it was 450,000 to it went down to 80,000. And so that's like a huge leap. And then it kept going down 10%, more than 10%. And then it started, the amount it started going down was less and less. And then it plateaued. And then at that point, there's some speculation that it can plateau and then continue to decrease. There might be some retained products of conception, or there might be some the growth there, but it can resolve spontaneously on its own.
Mhm.
But for some people, like 1% of people, it'll develop into gestational trophoblastic neoplasm. And so that's when it regrows. And so that happened to me.
Is it a cancerous regrowth or can it be a non-can?
It can be both. It's mostly considered malignant, and this is where there's a little unknown. There's different kinds of GTN. There's some that are extremely invasive and metastatic. So the doctor said, we'll need to do an ultrasound and a chest x-ray because it can spread. I not only had to grieve the miscarriage, the fear of my health, but now it was more like the fear of losing my life for a moment.
Very.
It has this effect similarly to staring straight into the sun when you threatened with the possibility of dying when everything all seemed so nice and normal before. So it was a bit blinding. I didn't know this was possible. The extent that I knew was that you can have a miscarriage, you can hemorrhage. The pregnancy can be ectopic, there can be placenta previa, there can be like some detachment of the placenta to the uterine wall. There's a lot of complications, but this one was new to me. And thinking about it, it actually physiologically makes sense because they're trophoblastic cells. So those are the cells of reproduction, and they replicate so quickly. And similarly, a cancer cell replicates extremely quickly. And so there can be a lot going wrong when the cells replicate that quickly.
Mhm.
The GI system and the skin, they have very
So back to your procedure and the recovery. You had the DNC, you recovered, and then the doctor wanted to check you again to make sure that you didn't have the regrowth, which you did. What happened then?
I came home from the gym one day and I felt this warm liquid going down my leg, and I thought, I must be having an incontinent episode because I had just had a DNC and that's what happens. But it was bright red, and then it kept getting heavier, and then there was more contents coming. So at that point, I knew something was very wrong. And I went to get my HCG drawn the next day. It was a weekend. I didn't go to the ER. I just laid down and it stopped. And then my HCG had gone up. And then I spoke to the doctor about it. We got an ultrasound, and they noticed that on the ultrasound there was an area that was being vascularized, so something like given nutrition to help grow, but it was a neoplasm. It wasn't because of a pregnancy or anything like that, and it was
What's a
in
neoplasm?
neoplasm it means new growth. So it's pretty nonspecific, but it's a term used for a tumor, basically. So that's what was growing, and then that's when they said, "Also get a chest X-ray to see that it didn't spread to your lungs." And then at that point, I was sent to an oncologist. And the oncologist said, "Your options are you can have another DNC with a 60% chance of needing chemotherapy, or you can just skip the DNC again and then just have chemotherapy." So I opted for the DNC, and I was monitored for a few weeks after the second DNC, and then it finally got to 0 and I didn't need chemo.
What a relief.
Yeah.
How was that for you receiving that news?
It was like this never-ending miscarriage that finally ended. The accumulation of all the emotions during the time came to an end at that point. It's like graduating high school. I mean, not it's different, but it's the end of a period.
Mm.
I had so much reflection about how to prioritize emotions and reactions and how calm I felt about all sorts of other areas of my life because I only had so much emotional reserve, and I was just a lot more soft and vulnerable feeling. When it came to an end, I was light, and I kept that perspective too. Today wish that I still had that perspective, that the smaller things don't bother me. Paperwork, finances, toddler emotional dysregulation, my parents' preferences, traffic, a bad night's sleep is just so much smaller and significant than something that's actually life-threatening, and I think that I can only know that when I experience it firsthand. It's not like a meditation I can drop into. Possibly actually could be a meditation I drop into, but have I or will I? Maybe not. It's almost like a psychedelic experience.
Yeah, it alters your state of consciousness. I've not personally experienced facing my mortality in that way to that degree. I've had autoimmune issues, and when the symptoms first started, I didn't know what was wrong with me. So I kind of went there, but nothing like what you're describing is like you're literally staring into the sun and you're being blinded by this contrasting experience. That must have taken a lot of courage for you to wade through, not just for yourself, but having a daughter. There are demands as a mother, right? That just never stop. So, how were you able to wade through that period while life was still continuing around you?
I love that question, and it's something that I think about even if the circumstances weren't life-threatening, and it has a lot to do with my toolbox, which is cultivated and grown. And that was really the only way I can empower myself to continue is to take control of my health. I felt robbed of my control. So at that point, I wanted to respond aggressively about it. And then I was so hyper vigilant about everything that went into my body. It gave me such incredible energy too. I did just the right amount of physical activity, not too much, not too little. I had just such incredible meditations with my uterus. It was talking back to me too. Breath work as well, that slow, deep breathing to counteract any sympathetic nervous system activation, which was
So in your toolbox was nutrition, philosophy, breath work, gentle mindful movement. I also heard meditation that was meant to connect mind body and specifically that. And it's so interesting. We're going to circle back around to the meditative state of connecting to one's uterus. But first, I want to know what nutritional choices did you make or not make intentionally during that time for the healing of your body, for the nourishing of your body?
I was introduced to a woman who fought cancer through a certain juicing regimen that she did. I had liked juicing many years ago, but I didn't think it was so sustainable as nutrition. But I revisited it intuitively and just because also this person is introduced at the same time, serendipitously. I was making pure vegetable juices with kale and a lot of cilantro, which is healing and detoxifying,
Mm.
beets, cucumbers, celery, and I wasn't using fruit because also intuitively I thought sugars can feed something I wouldn't want them to feed. And sugars in the blood, when they're lower, you're in a healthier state. When you're higher, there's more insulin resistance, cortisol release, metabolic dysregulation. So I was doing those. I was extremely hydrated. I didn't have any coffee or alcohol. I was mostly vegetarian. I was plant-based, but normally in my life, I eat animal products every day. But something told me that the animal protein and also things I read and also intuitive eating, and that could also feed into growth I wouldn't want at that time. It was mostly a lot of plants and then whole grains and healthy fats, nuts and
What kinds of
avocados.
whole were you gluten free at the time?
Necessarily, we would soak all of our grains before we cooked them on the stovetop, but I wouldn't eat any milled grains like breads or things like that. But I would eat rice and quinoa, buckwheat, millet, amaranth, farro. There's so many different kinds of grains. That was grounding for me because it wasn't having as much animal protein. I didn't have anything that came from packaged actually fill up our grains at a refill store on Laurel Canyon and Ventura. They're all package free. I also had a decreased caloric intake because I was pretty anxious. And then I had this idea that something was growing in me and I needed to starve it. And so I can't necessarily say if that was the right approach, but it had given me a sense of control. And so that could actually edge into anorexia, eating disorder, but it wasn't necessarily for a body image as much as it was based on fear and self-preservation.
Yeah. Let's talk about the meditations.
Yeah.
So interesting. I know that when I was preparing to undergo endometriosis excision surgery and the removal of my septum, you gave me that idea too. Talk to your uterus, talk to your ovaries, connect with them, and send intentional energy that way. And I thought that was so beautiful when you say you did meditative practices to connect to your uterus and you felt like it was like this bidirectional energy exchange. Is that what you would call it? Can you tell us more about that? Because that can apply to period issues or trouble conceiving or anything that has to do with our womb.
Absolutely. To say that there's a disconnect between the mind and body is an understatement when we just go about our day to day without giving it that kind of attention. And I'm guilty of that today because cleaning the house, going to work, taking care of things, and I sometimes don't just take a minute to talk to my body. I am not separate from my body. I want to be in agreement with what we decide together. I thought that that would be then a good time to drop in and communicate, and it's not it doesn't happen the first time necessarily unless there's, like, a had already been a practice of meditation, and it takes a certain amount of belief too because my uterus doesn't use words the way that my vocal cords create them. They don't have vocal cords. All of these organs are part of our autonomic nervous system, and so that's not something I'm controlling. That's not me telling my muscles to flex or my lungs to inhale. They don't actually really need me to talk to them, but I can, and they can talk back, and I think it's possible.
What was your uterus telling you?
That's a tricky one because I might have made it tell me something. It was telling me that it was gonna be okay, and it might have been because I needed it to, and I didn't wanna give it another option. So that's what I was hearing it say. I was hearing it say that it's having a hard time and that it's gonna be okay. So really not much, but just what I need to hear. And a lot of the time, you don't need a lot of words, right?
Words convey emotions, and emotions can be considered just frequency, like energetic vibration. I think both things can be true. You needed to hear that reassurance. And it was also letting you know, we're going to get through this and we're going to come out with the golden wisdom of this experience.
Yeah, the golden wisdom of this experience, exactly. The uterus tissue is just phenomenal, the way that it can shrink and stretch. The bladder tissue does it to a certain extent, but there's nothing like that uterus tissue in our body. The amount of growth it can take, both literally and
Yeah. And the wisdom of knowing the timing of like, now's the time to shed our layer. So, how has this experience shaped the way you think about future pregnancies?
I have a lot of fear about it. But I also simultaneously feel prepared for it. My first pregnancy kept me in the most naive place. First try, easy pregnancy, home delivery, no complications. I didn't even know I had been diligent about taking care of my health my whole life. I have been sharing how to do it with other people. And then so for me to be attacked was such a different experience than what I thought was even possible. I started looking into rates of miscarriages and learned that it was every 4 to 5, 20 to 25% of pregnancies end in miscarriage, and that's just so high. And so I started thinking scientifically, okay, then that's mostly normal. If that's as much as it's happening, then you can almost normalize that. I wouldn't say normalize that in the sense that then be emotionally okay with it and then don't look into why it's happening, but just that you're not alone, essentially, far
Yeah.
from alone. And so thinking in the future pregnancies, I read books about optimizing my hormones, optimizing my egg quality, and then just again, similar concepts to having that control of my health. I don't know what I would do or feel if I had another molar pregnancy. I mean, I don't know if it would be the same emotional as last time. The chances of it happening again is 1% the second time, or I think it's either like 1 to 5%. And then if it happens, if we get pregnant a third time, then it goes up to like 15-20%. But essentially, the molar pregnancy can only happen if there's a chromosomal abnormality or if there's no fetus there. So otherwise, it shouldn't. I want another baby so bad. I have the strongest baby fever. Like one of my friends got pregnant and I just like I can't even see her. It's so sad. She's such a good friend. And then I have to bring myself back to the present day and the gratitude I have now for the love of my career, the love of my family, the health that I have now. Okay, so first and foremost, right, that. But pregnancy also is supposed to be a time where we're like, okay, and now I will be more calm and I will have like positive mind so that I can have positive fetal development. And so I just find it really hard to realistically have that with the fear from what I experienced.
Completely normal. I had a miscarriage before IVF with Sophia. I was so scared that any little pain or tug would be that. And I was still checking the toilet after I peed for months. I think it's very true what you're saying. And then it happened. I felt really alone. It was a very lonely, isolating experience to go through. And then I started hearing of women and couples who had that, sometimes multiple miscarriages before having their kids. That's completely understandable to be feeling that way. And the desire for a second baby is a very interesting one because I'm just speaking for myself, right? Because I'm in the trenches of secondary infertility right now, but it's like you have this huge love and gratitude for the little being that has made you a mom. And then sometimes I'll look at her being all cute and special, and I'll feel this. I don't know if the word void is the right word. It's almost like my heart has another chamber, and I have this deep longing to fill it.
Oh, yeah.
And I have started trying to really think about because the more I try to control it happening, the less it's happened. The
Right.
more random complications come up, boulders in the road that make me be like, okay, now I have to wait 3 months, or I have to have surgery, I have to recover for this. So I guess for you, how has it been this period of waiting to conceive? What have your doctors or your doctor told you about conceiving for the next baby? What guidelines have they given you? And in that period of waiting before that pregnancy manifests, how are you navigating that waiting period?
That's such a good question. They advised to wait 1 year after my HCG was 0. So it was 0 February 2023. So they said wait February 2024 or beyond. I had read, and this is for GTN. If it was just a molar pregnancy, it would be 6 months. I had read that if you don't have chemotherapy and you had GTN, you can wait 6 months to a year. And so there's some doctors that say that and some that say 1 year to be more conservative. And I'm a medical professional. I think that my patients should not go against medical advice. It's for their own good. Everything inside of my being wants to go against medical advice and conceive earlier than they recommended. And so my partner and I are thinking of doing it a little earlier, trying a little earlier. That's so difficult to talk about and admit as a nurse practitioner and as somebody who had such a terrible experience and would not want it to happen again. Shouldn't I be more careful? And that just has to do with this waiting period feels like so long because of how deep I desire to be a mother again to another one. And my family is just not complete in my heart. I can't tell you if I'm a patient person or an impatient person, but for this situation, I am very impatient and also feel inside of me that I've healed. And I know that. I feel that I've healed. And I think that's why I allow a sooner start date. And mind you, it's not really all that much sooner. I would say just a few months. So, yeah, the waiting is interesting. It just kind of shoves me into the present every time. What am I grateful for now? Because it's not about the future. The future will give you what it does, and I won't know. And right now, because of my miscarriage and the complications, I found the right job for me. The job, the position that I have been wanting ever since I decided to be a nurse. This is the best one. And I wouldn't have been here doing this now with a company that I want to stay with for a long time if this didn't happen. So we lost one baby, but we had another baby in a different form,
A career baby.
a career baby. Uh, and so, yeah, I also can't be greedy. I'm going to say gratitude for the 100th time, but just to go back to that, because it's the only thing that makes sorrow better.
Oh man, I agree with that 100%. That's a beautiful answer. Thank you for that. The waiting, I try to look at that too. I try to balance my perception of this is taking too long. It should be here by now. Will it ever come? Right? I'm by nature, I am an anxious person. And so those are just my defaults of where my mind jumps to if I don't tame it. And sometimes I don't tame it as much, or there's sleep deprivation or something. So for me in the waiting for the second baby, and I totally understand that in your bones and in every cell of your body, you just have this desire that you want to bring through another soul. You want to experience, and you look at your firstborn and you think, oh gosh, I really want to make you an older sibling because I think you would just be amazing at it. But the thing that I'm really trying, and it's really hard, but that I'm trying to calibrate my perception of there's something wrong with this moment. There's something missing. It
Uh-huh.
should have been here already. Is I start asking myself the question, what would have been the drawback had it gone how I wanted? And what gifts or benefits have I been offered in this period of waiting? So I'll just share for me, I was very intent on having a 2-year age gap for some reason. And now that the age gap is looking more like 4.5, 4 or 5, somewhere around there, I'm starting to see the benefits of a bigger age gap for our specific family. I'm not making a blanketed statement that one age gap is better or worse than the other. I'm saying for our family, for our needs, for our individual needs as different family members, and collectively, I can see how this can be for the highest good of our family. I wouldn't have caught the endo when I did. I might not have, likely might not have caught the endo when I did. And it was stage 3 and it was in a lot of places. And I don't know what the repercussions of that could have been had I not been diagnosed when I was and not had the surgery when I had it.
Mm.
And then the career baby, I relate to you because this waiting time has given me a chance to embrace an unexpected pivot in my workflow. And I feel like this is going to create less stress later when I'm pregnant and when I have a newborn and all of these things. So my heart, it like joins yours in that waiting period because it is not easy. The
I really
gratitude.
feel I really feel that from you. I feel like we're in a similar boat, and I know that you had asked me another question about support systems.
We were gonna segue into that now. Tell me about.
Well, I really appreciate speaking to women who had something happen, and it does not have to be the same thing as me, who also have this sense of waiting for the next child. But what I was hearing you saying and what I want for myself and what I think I've tried to accomplish or have accomplished is that I am not waiting, but I am living. And we're glad about the choices that we have while we're living, and then reflecting on why it's better that something didn't happen versus why it's worse. And then, yeah, that age gap and just seeing that same thing, like 2 years, that's going to be that. But, oh, if it's 4, if it's 5, like there's advantages there. and to just open the aperture, see it positively, because that goes back to that's another tool in the toolbox for coping, because this isn't gonna be the end of something bad happening to us. We have so many more years to live.
Yeah, if
Yeah.
it's not one fire, it's another, but that's life. It's putting out fires and learning how to do it a little bit more mindfully than the last time. So talk to me about your support system. What's helped?
We get together with friends and family, and it's always the first question is, "How are you?" And the answer is, like, mostly usually, "It's good." During that time, I actually felt some kind of liberation to say that it's not good, and there was a solid reason behind it. And sometimes there doesn't even need to be a solid reason behind why it's not good. I had just fully let my friends be there for me. I let it be about me. Taking care of patients every single day, it's not about me. I'm not telling them about myself. I'll tell them a little so that we can have a rapport, like you had said earlier. But at that point, I experimented with that, and when I had never experimented with that, I don't think ever before. But I remember we had our first play date, or no, maybe our second one in the park with Vivian, and we started talking about it, and I just immediately told you everything and started crying.
I remember that.
And I was like, I cannot believe that I just did that. But it was okay. I mean, I felt held by you, and, I had a sense of who I can tell and who I can open up to. I let it be that. I let myself be melancholic. I found a Facebook group because I was looking at cancer societies, resources, like group support, and it wasn't finding my niche. 'Cause it's just a specific thing. So I found a Facebook group that was My Molar Pregnancy. I was on it like 3 times a day, and I had no shame about my social media use at that time, because that's the support I wanted and I needed, and I got it. All of them with such high anxiety posts. I was answering all of them. I posted every day, and that was the first time I've ever really used social media like that, and I thought, "You know what? There is a good reason for it."
That's great that you found it's so powerful when you find other people that are going through exactly what you're going through. It's just so powerful to be able to share and to hold and to be held. Did you develop connections with some of the women in the group or
Not really. It was all behind the screen. It almost felt better that way too, for some reason, to take that one extra level and become their friend and actually see them in person. Other support, I did a lot of talking to women who had miscarriages,
that
and
must have been really healing for you?
yeah, exactly. It just because that also made me not feel alone. I mean, there's a lot of stories too, just traumatic stories that are not molar pregnancies, so
Did you seek them out or did you talk to them in your work?
we were friends, already friends, especially a lot of friends in their 40s. And when you get into your 40s, there's like a higher rate of miscarriage. That's what I was hearing from them. One friend had 3 miscarriages and she really wanted her single only child. She finally had delivered, I think, at 42. And then another friend who had tried for a long time, had a child with Down syndrome, and then had an abortion that resulted in, like, just continuous bleeding, had another DNC, had to wait a while, so similar almost.
Yeah,
And so I
that's
thought about, like, a theme and ideas for baby showers. When your first baby shower is so fluffy and sweet and kind of traditional, just like my mom's friends and my friends, and we're all sitting and we play games and we open gifts and lots of food. And I was thinking, if I had another baby shower, my baby shower would be like a woman's circle, where we all sit in a circle and everyone takes turns sharing their experience about anything around reproduction, because every woman has a story. And so I thought that could be a really sweet, even just like even as a birthday experience, like any event, I would love to do that.
I love that idea. I love hearing that. You had support, you supported yourself, you gifted yourself the chance to be held and have it be about you. And sometimes accepting that nurturing from others is not easy. So that is really powerful that you allowed yourself to do that. And then you also had that online component, which was perfect as it was. Like the form in which it presented itself was perfect for you. What would you say, looking back now with hindsight, what would you say you feel was lacking in what you would have wanted during that time? What would have made you feel supported, or any support resources that you would have wanted to see?
One thing in particular that stood out was that I was in a different job position then, and I had my boss, or the manager, I guess you can call her, she did our schedule, and I had said, uh, I have to take time off because I need to get my surgeries and recover. And then, prior to that, I had taken some time off because I had a DNC at my first DNC, and then it was like Thanksgiving and just a few things. And so by the last time I needed time off, she was not sensitive to what I had been going through. She said, "This is very hard for our schedule. We need somebody who's more consistent." And she had shared with me when I first started working there that she had some pretty terrible fibroids. And it just made me think, we could have created more like of a sisterhood instead of like this relationship that she had turned it into as stressful and not as supportive. And it then kept making me think about how little support there is for women in their jobs around when they have difficult menstruation, when they have divorces, when they have children that need to get picked up from school or something going on with their children, or when they need emergency procedures, or when they have a miscarriage, the grieving around that time to grieve, and that there's not a lot of room there. And I'm seeing it a lot with my patients too that have maybe PMDD or endometriosis, extremely painful periods, and there's like, well, you have 17 hours of sick day this year.
Yeah.
Just like a day and a half.
Let's not talk about postpartum too.
Oh, exactly.
Yeah, that-
So it for me, I feel like I had mostly what I needed, and I wasn't planning on staying at this position, but it just shed some insight about how much more support is needed. Uh,
What advice would you give to someone who's going through something similar right now? What would you say to them?
I hear myself saying this to myself, and I still can't imagine myself getting out of my funk just hearing it. But you will get through it. How many times have people heard that when they're going through it? Because every day is another opportunity for healing. I would also say that your strength will come at another time, and right now is the time for weakness. Weakness is the hardest place to be in. And then, you know what? Even before all that, I would probably just wanna say that, "Look, I see you hurting, and I'm gonna feel it with you. I'm gonna just be there with you while you hurt," instead of, what to look forward to or how to take yourself out or how to rationalize it. So basically simultaneously having any amount of acceptance in the discomfort and any amount of reassurance in the future of a more positive outcome.
That is so beautiful. That reminds me of a passage in Kristen Neff's self compassion book, which I'm reading for the second time. So I'm really wanting to practice that right now. And that's one of the things that I'm really working on is recognizing the pain and not trying to change it or move it around in any way. So, I mean, that's compassion, right? Is suffering with someone, being there in their suffering. I love that. That's beautiful. Is there anything that you wish you would have known during or before the process that you wish others knew?
I generally wish there was more information about molar pregnancies. And I remember reaching out to my OB/GYN and saying, like, what can I do to get rid of this faster? What can I do to prevent it? And they had nothing for me. And I thought even just the basic, just take care of your mental health, your digestion, your rest, and your social connections and support. I mean, not even that came from them. In addition to those things, I'd be interested in herbal treatments, like an even more transcending type of meditation around this.
Did you do any acupuncture during your healing process?
I was going to do acupuncture, and I went to one acupuncturist who said to abandon my gynecologist and oncologist and just see him and receive acupuncture and a herbal treatment, and I would be seeing him every day. And I felt that that wasn't the right way to go. And then I was gonna do acupuncture with somebody else, but I had my second DNC and I didn't end up getting it. I have faith in acupuncture.
Yeah, I do too. I mean, the research is solid, but run the other way when you hear someone saying such a black or white statement. At the very least, acupuncture for helping to massage the hormones at such a sensitive time to calm your nervous system, to help the cortisol kind of like chill out a little bit.
I would 100% do acupuncture if I went back. I was meaning to, and didn't get to it.
What would you say to yourself at the start of the journey? You're facing each other. What would you say?
I think this is another one of those answers that you hear from people a lot is I would tell myself that I'm so much stronger than I know I am. And I think that statement can only penetrate when it's the appropriate time or if somebody has been in something so deep as well. Because just simply the resilience of the body and it's always trying to fight for us in repairing itself. I mean, that's its primary goal is always just fighting to repair itself. And so physiologically, it's already happening. And so it's mostly the mental component. And that's when I tell myself I'm capable of taking in this information and having faith. I think there's a really strong mind component about having hope and faith. Anxiety is just so creepy. It just seeps in all of the cracks. And I think that hope and faith is an antidote for that. And so I would remind myself to have it.
It's beautiful.
This has been so sweet to talk about. I would love if other women can also have this just a simple discussion of or having somebody offer like you have offered me these questions and the ability to uh, have some kind of conclusion around it. And I knew this would happen when I was preparing for this interview, and that's why I was so glad and excited. So
Well, that
sincere.
leads me to my last question, which is how can friends, family, healthcare providers support someone going through this?
It's asking these questions to know what questions to ask. I mean, it's really an art. It's like a therapeutic art is to have the right questions to ask and to hold that kind of space for healing. And then if there isn't a lot of discussions to have, to still offer that kind of presence. This is from friends and family. As a provider, I think something that is so important to me is rapid communication. So if there's a situation where someone's not well and there's a lot of anxiety about it, or they're waiting for a test, they just had a test done. The minute I see it, I check them every day and I send them out and I communicate every day, and not to have a lot of lag in between because I think those waiting times can be so hurting and harmful. Continuity and of communication and presence. So
Julia, thank you so much for being so brave and wise and strong. And just, I really hope that whoever needs to hear this, I really hope that they find their way to this chat. Thank you so, so much for being such a gracious spirit of coming on here and talking to us and sharing your space and your time with us.
thank you, Asmata. I hope that anybody who experiences this can find some reprieve from this conversation. And again, I express my gratitude.